Welcome to this short tutorial for the serratus anterior plain block. The serratus anterior plain block is a form of regional anesthesia. It can provide effective analgesia for patients with 2 or more acute anterior lateral or anterolateral rib fractures. Some contraindications include local anesthetic allergy, localized infection at the site, and inadequate assessment of anatomy by ultrasound.
The serratus anterior plain block can be used to provide analgesia to anterior and lateral rib fractures in the T2 to T9 dermatomes.
In order to perform the block, you'll need to gather your supplies. Order the anesthetics that you'll require, which are lidocaine and marcaine. The lidocaine is used for the skin wheel, and the marcaine is used for the nerve block. For a normal-sized adult, 15 ml of 0.5% marcaine can be mixed with 15 ml of normal saline in a 30 cc syringe. You'll also need to find the ultrasound machine and the block bags. The block bags are located in trauma behind the physician workstation.
To perform this block, you'll want to position the patient in a lateral decubitus position, and then you'll stand behind the patient, placing the ultrasound machine on the opposite side of the stretcher. You'll scan with the linear probe in the musculoskeletal setting in the transverse plane, with the probe marker positioned posteriorly, as is demonstrated in this picture.
This slide demonstrates the anatomy of the region we're going to scan at the 5th intercostal space in the mid-axillary line. To the left side of the screen is the rib. To the right of that is the pleura. Superficial to the pleura are the intercostal muscles. Superficial to that is the serratus anterior muscle. And most superficial is the latissimus dorsi muscle. The anesthetic will be deposited in the plane between the serratus anterior muscle and the latissimus dorsi muscle. The plane is delineated by the hyperechoic horizontal fascial tissue in between the two muscles, and it's also highlighted in purple. There are some resources online that opt for the deep plane technique, which requires deposition of the anesthetic deep to the serratus anterior muscle. However, in this tutorial, we will only demonstrate superficial infiltration.
So this clip is demonstrating the serratus anterior block. So we see here that needle is coming in on the left side of the screen, entering that superficial plane between the serratus anterior muscle and the lat dorsi muscle. And we're injecting some bupivacaine here, and we see the muscle layers separating nice and easily. They almost peel apart. And when injecting that anesthetic, it really should feel very smooth, almost like injecting saline into an IV. No resistance at all.
Before performing the block, it's important to identify the thoracodorsal artery. You can use powered Doppler and ultrasound to identify it, as demonstrated in this video. The artery is indicated by the red arrow. In addition, patients should be placed on cardiac monitor before and after performing the block. It is also important to ensure that they have IV access. You can also look for lung sighting after the procedure.